100, going to cover on how it helps to gain access to quality care. So starting in learning objectives, going to have a brief introduction to telehealth, going to show the different types of telehealth, technology involved with telehealth. Also going to give some instances on how telehealth improves access to care and quality care. We're going to go over cost of the facility, reimbursement from Medicare, Medicaid, and insurance, some of the limitations of telehealth, and finally the conclusion. So, what is telehealth? Telehealth is a branch of e-health that uses communication networks for delivery of healthcare services and medical education from one geographic location to another. Simply put, you're in your house, doctor's office, place of that nature, you need to get additional screening done by a specialist or something of that nature. You can generally do it by video monitoring. Your doctor can do a telephone consult with specialists, things of that nature. Different types of telehealth. There's synchronous, which is real-time telehealth encounters are characterized by the use of interactive electronic communication exchange in at least two directions in the same time period. Like I said previously, for example, live video conferencing provides face-to-face communications between providers of a specialty and a patient. Another type you have asynchronous, which is telehealth encounters involve transmission of medical images or information in one direction at a time via electronic communication. This is where you're sending like your x-rays from one location to another. You're sending like telederm, where you'll take a picture and an encounter will be written, and then that is transmitted to a dermatologist in a different area. Different specialties that your treatment facility does not currently have. This allows them to seek additional resources at another location to hopefully give a better prognosis or diagnosis of your condition. Another type is remote patient monitoring, often used for seniors or in senior living areas. Remote patient monitoring is a collection of patient health data from a patient or resident in one location that is then electronically sent to a healthcare professional for monitoring and review. Remote patient monitoring is especially helpful in senior living areas in order to prevent falls and keep a watchful eye on residents' vitals. So it's like having your blood pressure taken by a device and then having it uploaded into a database where your physician or nurse can monitor your blood pressure. Also helpful with diabetes patients. Youth with asthma utilize this type of resource, and so on. Another is mobile health. Mobile health uses smart devices. Mobile health is used with smartphones, smart devices, tablets, and with health-based software apps developed for these devices that support continuous healthcare. Many health-based apps exist now and can monitor everything from diabetic patients' blood sugar levels to one's daily water intake. These apps help to encourage healthier lifestyle behavior, and also, if designed to, can integrate with patients' personal health records. So, different specialties that use telehealth. There's dermatology, psychiatry, infectious disease, pain management, neurology, cardiology, rheumatology, gastroenterology, sports medicine, and oncology. These are all different specialties that are not generally located in a local treatment facility, especially when you get to your rural areas. These type of services are not easily accessible. So telehealth comes into play with this in order to help get them the services they need to help live a healthier life. Involved with telehealth. Obviously, you're going to need a high-speed internet access. So broadband internet is necessary for telehealth applications. You're going to need compatible technology between the originating site and the distant site. Generally speaking, if it's not compatible, it's not going to work. At a minimum, a site is going to need a computer, a tablet, or smartphone that interfaces with some sort of telehealth platform. For video conferencings, you need, at a minimum, obviously, So some of the benefits for telehealth. You're going to have a decreased number of patient transfers. What that means is your primary care physician is going to be your one source for treatment. When he transmits your information to a specialist or something of that nature, basically it's a consult to where your PCM is going to be taking their advice and basically performing the treatments. General practitioners are just that. They're general. They have a very large overview of body systems and things of that nature. When you get into like endocrinology, oncology, that's when these specialists have in-depth knowledge of that particular field. But all of your care is going to be coming from your PCM. So it's also going to decrease the number of trips by the provider and the patient. Basically, provider's not going to have to go seek out that specialist in order to get additional information from him. It's going to be right there, available via either webcam, telephone consult, something of that nature. This, like I said previously, is going to meet the needs of underserved population, such as your rural areas, Native American reservations, remote locations, such as in Canada, things of that. It's also going to help build provider and patient knowledge, and it's going to, again, reduce rural isolation. So, types of things that help to improve communication, obviously telephone, text message. This is going to come into play with your younger generation because they like to text all of their information all over the place. And this communication is generally speaking between the provider and the patient. Emails, the online portal for prescription ordering, that's basically where the patient will log into the treatment facility's online portal in order to refill their medications. Portals also have additional capabilities to where you can actually review your own lab results. You can also look at previous histories. You can seek to see if there's any kind of consults in the system for you or referrals and stuff. Then you've got your telemedicine. Telemedicine is just that. It's basically a video platform to where you're consulting with a specialist in a specific field. Generally speaking, it is normally used in a primary care setting, and it's consulting with the doctor at a different clinic. Actual telehealth is generally in the home. Again, this is where you start using the biometric devices, and that way your blood pressure, blood sugar, tidal volume for lung capacity are retrieved electronically from either the nurse or the doctor himself or herself in order to review for your health. So, telehealth helps improve access to care and quality of care. So, it improves access to care. It gives faster access for the patient to their health professional. It increases convenience, time saving, which is time saving for the patient. Improves quality of access of care between and within the regions. Basically, you're stuck in Hays, Kansas, and you gotta have a referral to a specialist, but you can't make the 120-mile drive to Denver. So this helps improve your ability to actually get that specialty care that you're needing at the time. It also improves access between and within the primary, secondary, and tertiary care. So, improvements to quality care. It improves the continuity and coordination of care. Basically, you have the one provider who's taking care of all of your needs. He's just getting advice from another doctor and performing the procedures that are dictated by that other provider. Timeliness of care, you're going to actually get taken care of a lot quicker. It's going to reduce exposure to unnecessary diagnostic tests and procedures. When you go from one provider to another, yes, your notes follow you, but generally speaking, that provider is going to want all the information from his observations and his exams. So by having one doctor who do all the exams and then getting second opinions and things of that nature from a secondary doctor, it's going to help. More of the needs of the patient is locally met. It goes back to the previous statement, and it provides information transfer between providers. Doctors are always learning. They don't know everything. So by getting that consult from that specialist, then it's actually improving that doctor's knowledge base. Okay? So, cost of facility. So, you have two different types of costs. You have your fixed costs, which is equipment and technology, depreciation of equipment, and the facility costs or the office space. Second cost is your variable costs. This is where you're going to get into your maintenance and repairs, your telecommunication costs and supplies, administrative support, wage to staff, travel for training, promotion of the program, training the staff from the supervisor, program costs, and wages to the technician and to the staff. Medicare and Medicaid does reimburse some forms of telehealth. Basically, it comes to a telehealth consult in the emergency department or initial inpatient, your follow-up inpatient, office and other outpatient visits or subsequent nursing facility care visits. Those type of visits, you get one telehealth visit every 30 days. Individual and group diabetes self-management, individual psychotherapy and intervention, pharmacology management, psychiatric diagnostic interviews, examination, and other subspecialties. There are limitations when it comes to telehealth. I mean, obviously, you're going to have your technology limitations. Some systems are just not compatible with others. It's going to give a sense of depersonalization. Basically, you're watching this doctor on the television screen and having a conversation with them. It distorts reality a little bit. There's a different process when it comes to the consultation. There's going to be ergonomic issues, basically, where that doctor is not actually going to be able to put hands on you in order to perform an exam, so he has to go off of the information that he receives from the referring provider. It can reduce confidence of a patient and the health professionals. Watching somebody on a TV screen, you don't know how serious they are. You know, there isn't, you don't get to see their full body. You can't figure out their body language, because communication obviously is two-way communication. Even though you're not saying something, your body's going to be saying something. So something could possibly be lost in the translation. And again, doctor's going to have an inability to perform the whole consultation. So, in conclusions, there is evidence that shows wide-scale implementation of telehealth will greatly improve access to specialists, improve the provider's experience of care, reduce healthcare costs, and potentially have a tremendous positive impact on the quality of patient care beyond access. And that's my last slide. Here's my bibliography. And have a nice day.